So this here is the sternohyoid muscle. It's a very big muscle, long muscle, and it's actually wider than this, and it is the most superficial muscle. When you open the neck, remove the skin and fat, this is the first muscle you'll see, and you'll have to reflect the sternohyoid muscle to be able to see the thyroid cartilage and the trachea. For simplicity, I am just showing the sternohyoid and sternothyroid muscles beside each other, but know that the sternothyroid muscle is beneath the sternohyoid muscle. Beside the sternohyoid muscle is another muscle called the omohyoid muscle. So again, I'm only drawing them on this half because so you can imagine exactly same mirror image exists on the right side here. So this muscle here is called the omohyoid. So that's again omohyoid muscle, and it has two bellies. The superior belly that attaches here to the hyoid bone, and it comes down, and then it narrows and becomes wide again. That's the inferior belly. Okay, so there is the superior belly here, coming like that, and then a narrow, and then inferior belly, and it attaches to the scapula. So here it is, the omohyoid muscle, the superior belly, inferior belly. Note that the omohyoid and the sternohyoid muscles are the most superficial of all of these. And then beneath the next layer, so after you cut and reflect these sternohyoid and omohyoid muscles, you'll be able to see the thyrohyoid muscle over there, the cricothyroid muscle, the short one connecting the thyroid cartilage to the cricoid cartilage, and beneath the sternohyoid muscle is the sternothyroid muscle, connecting the thyroid cartilage to the sternum. So this is the same image here shown from the side view, lateral view. So here is your hyoid bone, thyroid cartilage, cricoid cartilage, and the trachea. Here's the thyrohyoid membrane, cricothyroid ligament, cricotracheal ligament, and the rest of the trachea. Now there's 3 sets of muscles here on the posterior side of the airway. Now I have only shown 2 of them. So these are called pharyngeal constrictors. Okay, pharynx means throat, so pharyngeal constrictors. There's 3 of them: superior, middle, inferior. I have only shown 2 of them, middle and inferior. Okay, the superior would be higher here, but I have not shown it. Okay, it would cover that area. So the superior, middle, inferior pharyngeal constrictors. The middle pharyngeal constrictor is, because if you study the anatomy of the pharynx, you'll note that the pharynx is divided into 3 sections: the nasopharynx, oropharynx, and laryngopharynx. Well, you can think of these pharyngeal constrictors, the 3 of them associated with each of those pharyngeal regions. So superior pharyngeal constrictor with the nasopharynx area, middle pharyngeal constrictor in the oropharyngeal area, and the inferior pharyngeal constrictor is in the area of the laryngopharynx. Now, okay, so here the middle pharyngeal constrictor, note that it attaches to the hyoid bone. The inferior pharyngeal constrictor attaches to the thyroid cartilage and the cricoid cartilage. The portion that connects to the thyroid cartilage, it is called the the portion that connects to the thyroid cartilage is called the thyropharyngeus muscle. The portion that connects to the cricoid cartilage is called the cricopharyngeus muscle. Altogether, the 2 thyropharyngeus and cricopharyngeus muscles together called the inferior pharyngeal constrictor. And look here, note that the inferior pharyngeal constrictor wraps also around the esophagus.